Call the Health Committee meeting to order. Under previous business, can I get a motion to approve the previous meeting minutes? Motion by Mert, second by, is that Gary's hand? All in favor?
Yep.
Any opposed? Thanks.
Bless
Under current business, number one, authorizing an agreement with the State University of New York at Albany School of Public Health regarding student internships. Dr. Whalen?
Good evening, everybody, and I would like to just take an opportunity to introduce Shauna Witherspoon, who's our new Assistant Commissioner for Finance, who's accompanying me this evening.
Welcome.
I have three fairly straightforward ones. The first is for us to enter into an agreement with SUNY to really, they have a Master's in Public Health program, and they have interns that come and spend time with us, and this has been a relationship that we've had back and forth with them for a long period of time, whereby they can come and get practical experience at the health department to contribute toward their Masters.
Motion second. We have a motion, hold on. We have a insurance in place for the interns?
We do. SUNY has insurance.
Great. Okay, motion by Gary, second by Mert, all in favor?
I just have a question. It said the impact zero, so these are unpaid interns?
That's correct.
Okay. We have paid interns in the county.
We have a motion.
Actually, that's a question. Sometimes we have unpaid and sometimes we have paid. What? Anybody know how that's?
It's a question for audit finance or finance department.
Can you resend his paper?
So we have a motion and a second, all in favor? Any opposed? Unanimous. Number two, authorizing an agreement with Cornell Cooperative Extension to provide training courses for lead-based paint remediation certification.
So this is something that is funded through the New York State Department of Health CLIP grant, which is Childhood Lead Poisoning Prevention. And it is a contract through Cornell Cooperative Extension whereby they provide classes for individuals such as contractors and renters, building owners to become certified for lead abatement. And the classes help them to prevent lead poisoning in Albany. As we know, we have a lot of old buildings in Albany in need of remediation with a lot of lead paint, which does contribute to risk for lead poisoning.
Any questions for Dr. Whalen? Can I get a motion to approve? Motion by Brian, second by Gary, all in favor?
Aye.
Any opposed? Unanimous. Number three, authorizing an agreement with the New York State Department of Health AIDS Institute Health Research Incorporated regarding the expanded partner services program.
This is another grant renewal through the State Health Department, using HIV data to identify individuals who have fallen out of care, and we have nurses that track these individuals down and do what's necessary to make sure that they are getting the treatment that they need and get back into care.
Any questions?
I have some questions here. You don't hear as much about AIDS as you used to in the headlines. Is it still, you have the AIDS virus and then there's full-blown AIDS, is it still characterized that way?
It is still characterized that way. Right now, the New York State Department of Health has a focus on ending the epidemic. So they have a goal to decrease the rate of HIV transmission and new cases down to 0. That's the goal by 2020. So while we don't have as many cases as we had before, it is still a public health concern. And we know that people who have HIV are less likely to spread the disease if they are on medications and are virally suppressed. So the goal of this is to find those individuals who have HIV, and they may have the full spectrum of disease. They may just be HIV positive and have absolutely no symptoms to full-blown AIDS, but they are not getting the treatment that they need in the form of antiretrovirals. And so it's hooking them up with providers and making sure that they're on the medication that they need, both to treat their individual disease and to prevent them from spreading it to others.
So if you have full-blown AIDS, it seems like they have medicines now they didn't have before, and they're extending the life. Is full-blown AIDS still the death sentence, or can you extend the life so much that it really isn't?
Well, when you talk about full-blown AIDS, what you're talking about is somebody who has probably a very low CD4 count and is susceptible to opportunistic infections. And opportunistic infections can kill people if they don't have the proper immune response. So again, if you have somebody that's on antiretroviral treatment, the likelihood is that their virus is suppressed, that their CD4 count and immunity is good, and they're less likely to get those conditions which could result in their demise.
So we're saving lives then, even when, but there's still people dying from AIDS, obviously.
There are,
But it's a lot fewer than it used to be.
yes, that's correct.
Gary?
Is there an individual who's managing this grant already a county employee?
This grant does contain personnel, a portion of personnel.
I'm looking all through this and I don't see that.
Okay, I think if you look at the appropriation, this, on the second
Parts of-
page,
Yes, parts of the RLA, you'll see that the grant is paying for salary, fringe, and contractual amounts.
Okay, so whoever we hire for this is understanding that when the grant's going, they're going?
well, this is a grant renewal, and it's longstanding, but,
Well, you never know what's going on in today's world.
no, you never do. You never
What was that
do.
last year? Doesn't mean
Yeah,
we'll get
but-
next year.
Yeah,
Yeah.
any position in the
Everybody-
county that's funded by a grant.
It's an understood fact.
understanding.
Yep, it's understood.
I think I recall approving this 10 years ago. It seems to be a pretty popular program, correct?
Yeah, but you know what's another popular program? Meals on Wheels,
Well, that's true.
and that's getting cut.
Good point. So any other questions? Can I get a motion to approve? By Brian, second by Gary, all in favor?
Aye.
Any opposed? Unanimous. Number 4, approving the bylaws for Community Services Board.
Yeah, I'll take this one. This
Okay,
is, Community Services Board has put together some bylaws which they submitted to us. We reviewed them. They're consistent with the statute and they're fine form to be approved.
Are there any changes?
We made some minor, more of a legalistic thing than, no substantive changes from what they've proposed.
So these are amended?
I don't know that they had them before. We weren't able to locate them, so
Okay.
I'm not sure if they're amended, but they replace, shall we say, any existing ones.
Just
Motion by Gary, second by...
Got one question. Just on the procedure of amendments going forward, do we do that, or does the board itself do it? Because it looks like here it's 2/3 of the board.
Everything that they do is supposed to come back to the county.
Okay.
They will come back to the county for any changes that they have on either the board or their bylaws. I'll review that again, but I did change that unless that's an older version. I know what you're saying.
Okay.
Yes.
Thanks.
Thanks, Pat. Any other questions? We have a motion by Gary, second by
I'll second.
Brian, and all in favor? Any opposed? Unanimous. Number 5, authorizing an agreement with Ellis Hospital regarding the morgue and laboratory services. Tim?
Good, good.
So Ray, what I understand is we had a temporary.
We had a six-
This is gonna work out.
6-month agreement with Ellis, it's worked out well. No issues, no problems. Looking to extend it for a year. We've done 33 cases out there since October. No problems whatsoever. Like I said before, it's not as much Ellis, we need the doctor that works out of Ellis. Once a month.
Make a motion.
We have a motion by Gil, second by Mark. Is that-
Just a question.
Sure.
As I recall, Ellis was cheaper than Albany Med was.
$815 we pay Ellis, and I think it's $860 Albany Med.
A little more. And the reason we're at the maximum that Ellis can handle, as I recall.
It's all they want to do, the doctor, 1 week a month.
What this county works for.
Yeah, it's right.
For us, for Albany.
You get them to do more?
He does other counties, other weeks. That's how they all work. Sickareca will do 1 week Albany County, and then he'll cover Columbia County, Rensselaer, Saratoga.
So it's 1 week because this is the only 1 week the doctor wants to work
For us.
for us. Well, that's what I'm speaking of.
And in regards to us, they probably work a little bit more, but we pay them the least out of everybody.
Yeah, and I find that comforting.
For now,
There's only a handful of people in the immediate area that do this kind of work, correct?
there's only a handful.
Yeah, so kind of limited.
And as they get older, we're probably gonna have a little problem down the road here.
Wanda, did you have a question?
Can you give me an idea on how many, or what the number would be on an average,
Autopsies that we do a year? About 225. Give or take, sometimes it can be 250, sometimes it can be 200, all depends.
in all of Albany County?
all Albany County. That's autopsies, that's not cases that we handle.
Say, that's all that's dying? So just, okay.
That's just autopsies.
Tim, how many cases you guys
You know,
have?
this past weekend, Wanda, I was on for the whole weekend. I had 14 calls, extremely busy. Only 3 were autopsied.
We've seen, okay, go ahead, Gil.
Tim, how many cases you guys do a year, roughly?
1,200 are reported to us,
1,200?
probably.
Read the first sentence.
Any
About
other questions?
1,200 are reported. And that's hospital deaths, Gil, outside cases we go out on. About 1,200 are reported. Out of the 1,200, around 200 are
It's a busy
autopsies.
schedule.
Yeah, it can be. I was pretty busy this weekend.
How many of those autopsies are out of county?
Well,
That fly in the Albany Med, that
Had
Albany
a,
Med flies into them on their helicopters,
well,
and
we-
die here in Albany County.
we had a 24-month-old fall into a swimming pool over in Columbia County Friday, died Saturday at Albany Med, our case. Trying to think if I had another one. Had another one that was airlifted in,
Oh, yeah,
motorcycle
not an
accident.
individual, just
No, I'm just
somebody.
saying, you know, I mean, there's enough, there's enough.
It's
Well,
fine.
you know, as long as we
How many
got,
is it?
I don't know that figure
Can
off.
you let me know?
Yeah, we could
I'd
probably
like
look
to
at
know that, yeah.
I mean, that's
Yeah.
important. I mean, this is a pet peeve of mine, that, you know, not only being a resident of Albany, the city of Albany, and what
Right.
they don't do for the city of Albany
Started, I was talking
taxpayers,
about this.
what we do for them, with them encouraging their businesses, their growth up there, and it's costing the taxpayer. I thought we guys were gonna meet with them, Mr. Brockman, on this, a couple of months ago.
We did.
How we make out?
There's nothing we
Well, I mean,
They said we're getting a good deal.
yeah, we have
That's
no
their answer?
leverage.
That's
Yeah,
their
yeah,
answer.
yeah. There was also, if I remember correctly, a lack of responsiveness in general to the request to sit down and talk
That's
about it.
Barbara. I mean, it's gonna come
But you know-
to a point.
Gary, that's a trauma center. As long as we have that trauma center, you know, it's,
Oh, I understand that.
and we're fortunate to have it, but, you know, on the downfall, when people expire.
Why can't we build back Columbia County or Greene County for the services that we're doing here in Albany
I
County?
thought I gave you a copy of that state law.
It's a
that
state
says we
statute.
Now, that was
can't.
an opinion from the controller, that wasn't a state law.
No, I
I
think,
think
You're
there's a
supposed
statute.
to look at it.
all right.
Yeah, I remember you bringing this up.
There is a statute.
I remember.
I think we can.
That's out of my hands.
Well, it's my hands.
No, it's in your guys'
I'll
hands.
look into it.
Look
So
into
what are
it.
you saying, Gary?
I'm saying that anyone who dies at Albany Med, who were flew in here on their helicopter, brought in on our ambulances off the Northway, they come down here, they die, we do the autopsies. So the Albany County taxpayers pays the $815 for that autopsy. What I'm saying is, we should be billing back the county wherever that person came from.
Resident.
Okay, so, okay, so,
And I'm sure it's probably a couple hundred.
Couple hundred? No. I just told you, we do about 200 autopsies a year. They're all not outside the county.
Well, I bet a lot of them are. So I'm saying is, we
Probably-
should
probably-
recoup that money back.
Probably
for the
50 or
county
60, I would say.
taxpayer. All right, 60.
I mean, yeah, because it's great we have Albany Med, I'm glad we do to help people. But that's a separate question, and what is the residence of the people that come here, and why wouldn't that county pay for that service?
I don't disagree with you guys, just to make it a little bit measured, our taxpayers do get a real benefit from having one of the only level 1 trauma centers between 15 and 20 minutes from everywhere that they live. I'm not saying that accounts for all the costs, but looking at it from all sides, that is definitely a benefit to our taxpayers, that Columbia taxpayers don't
It's no more
have.
of a benefit than Schenectady or Rensselaer County.
I don't know that those are level 1s.
No, but it's 5 minutes, 10 minutes away to 11-1. It's probably just as quick for the guy to come from Broadway and Rensselaer than it is from my house to Albany.
I don't know about that.
oh, yeah.
Because on sales tax, when you buy a car, they go back to the county where you reside.
Right.
So that's how they, they're supposed to be acting based on the county you reside, but that's not the case with deaths.
You know something, Gary, another thing with Albany Med, besides doing the autopsies there, there's other things they do for us. I mean, we could have a case where somebody might expire and no one claims the body. The case might not even be autopsy, but guess what? The case might be in the morgue a month, 6 weeks. They don't charge us $10 a day or $50 a day where they could. Another thing is gloves, pouches, sheets, they just hand them to us when, you know, so we probably should really have a separate line item where we pay for that stuff ourselves, but we don't.
Should be a lot cheaper. If we can get them to bill us.
Gary?
We get them to pay the $8.15.
If we can charge them back, I assure you, we will. How's that?
We should look into it.
I'm just saying, I'll look into it, and if we can charge them back, I will see that we will.
Thank you, sir.
Okay.
Gil?
Well, in my opinion, with all due respect, Gary, I think it's in very poor taste
That's him.
to fool around with stuff like that with the dead.
Right.
It's a couple $100.
31 years.
I never heard nobody in my district complain about autopsies or dead people. But if we want to save money in the county, there's a lot of ways we can make the taxpayers happy rather than screw around with this nonsense. That's my opinion.
Just to be clear, we would be charging the people that had a loss in their family.
We shouldn't even be talking about it. It's ridiculous. It's not a big
Are there
expense to begin
any
with.
other questions?
With all due respect, Gil.
With all due respect,
Yeah,
with
let's-
all due respect.
Okay, any other questions for
It's in
Tim?
poor taste.
Can I get a motion to approve, to
Looking out for
move?
the county
Motion by
taxpayer.
Brian.
Very important.
At a very small
Can I get a
level, you're
second?
looking at the county budget.
Gary.
At a bigger level, there's a bigger
Chairman
level
is
you can look at
speaking.
county.
Guys,
And I'm 100% for
the
looking
chairman-
at,
Gil,
what?
The chairman is,
Get a motion on the floor.
the chairman is speaking.
You got a
With all
second?
due respect, I'm sure you.
With all due respect, I understand it's bigger saving, there's a lot of money we could save.
Chairman is
But that-
speaking, Gil.
And so am I.
I know, but the chairman has the floor.
Can I get a second?
Second!
Second by Mark, all in favor? Any opposed? Any
Have a
motion to
good night.
adjourn?
Some of it.
You and Gary can argue it out later.
All due respect.
All due respect, though.
I can't.
You did.